Today we are going to talk about Lassa fever. Facts, truth and lies about Lassa fever. What is Lassa fever? Lassa fever is an acute viral hemorrhagic disease that is caused by Lassa virus. And Lassa virus is a single-stranded RNA virus of the family Arenaviridae. What is the origin and distribution of Lassa fever? The first case of Lassa fever occurred in a town called Lassa in Borno State of Nigeria in 1969, where the virus derived its name. The virus is spread by common African rats, and the disease is endemic in areas where the animal vector is present. According to World Health Organization, the disease is endemic in Benin, Ghana, Guinea, Mali, Sierra Leone, Togo, Nigeria, with increased risk in surrounding nations. What is the transmission of Lassa fever? Lassa fever is transmitted by infected common African rats, and these rats usually excrete the virus through their urine, fecal droppings throughout their lifetime. So contact with the virus through contaminated surfaces, including contaminated medical equipment, food, may result in infection. There are two modes of transmission: direct contact transmission and indirect contact transmission. Indirect contact transmission, it occurs through the consumption of contaminated food or consumption of infected rats, or contact with the virus through inhalation, while indirect contact transmission is through person-to-person transmission after exposure to the virus. Now, once a person is exposed to the virus, it takes 1 to 3 weeks for the virus, the signs of Lassa fever or the symptoms of Lassa fever to manifest. It is believed and reported that 80% of those infected with the virus usually have mild cases, while 20% have severe cases of Lassa fever. Now, it is also reported that 15 to 29% of persons hospitalized with Lassa fever die from the disease, while the Lassa fever has 1% total case fatality. What are the symptoms of Lassa fever? The symptoms range from mild to severe ones. Like I earlier mentioned, there are about 80% cases of 80% of persons infected with Lassa virus get mild symptoms. And these mild symptoms range from slight fever to general malaise, weakness, and headache, while severe symptoms range from bleeding from the nose, the gum, the eyes, the mucous surfaces of the body, respiratory distress, vomiting, facial swellings, abdominal pains, chest and back pains, as well as shock. In both mild and severe cases of Lassa fever, neurological complications have been reported, and these range from hearing loss, tremors, and mild to severe forms of encephalitis. What is the treatment of Lassa fever? Proper treatment can only be carried out by a qualified health professional. And so it involves proper diagnosis of the disease by a qualified health professional, and treatment could involve the use of suitable antiviral drugs and also the use of supportive therapies. It is important to note here that effective treatment of Lassa fever depends on early diagnosis and treatment. So watch the video below and subscribe to this channel.